Excellent question. So first, let's talk about what's going on at the biological layer. When someone carries a large amount of fat for a long period of time, the skin stretches in order to accommodate what's underneath it, but it doesn't fully recoil if it's been overextended. So the reason why this happens is because the structure underneath the skin with collagen and elastin fibers, these tend to remodel very slowly. And once these are stretched past a certain point, they don't necessarily snap back completely. And age, genetics, and how long you've had the weight gain, these all start to play a role. So with significant weight loss, some degree of loose skin is inevitable. However, there are things that we can do to help mitigate this as much as we can. The most effective non-surgical lever is muscle, and it does two important things. The first one is that it can help occupy some of the volume that fat used to occupy. And then the second thing it can do is it can help reshape the structure underneath the skin and make the skin have a better appearance and function. And this is part of why you'll see some differences in what weight loss looks like on people who do it entirely naturally versus people who use a drug or some sort of intervention to lose weight. Now, this isn't anti-drug or anti-intervention. This is just the reality of how it works when you have a large amount of fat to lose. At certain amounts of fat, there's going to be loose skin. And if you have less of a muscle layer underneath the skin because you're not eating as much, you don't have the scaffolding that would give that skin some shape. So with my clients, we actually start having these conversations quite early, and I actually refer them to physicians who specialize in this area, because I know that when we get to that point, if you have a large amount of fat to lose, we're going to run into problems with comfort, quality of life, and movement. And so they'll have that conversation with those physicians, and they'll talk about what options are available, what's medically covered by insurance, and what's indicated. So I hope this answers your question. Let me know if there's anything I can clarify in the comments below, and I'll see you all in the next one.